Now we come to the second one. What is airway adjuncts? So we use a lot of airway adjuncts to maintain the patency of the airway. One of the airway adjunct that we use is called oropharyngeal tube. So this tube has a flange. This is the flange which is placed over the mouth, over the incisors, and this is the tube. The tip of the tube, when ideally placed, should be just above the larynx. So this helps to overcome the obstruction and give oxygen continuously. So what are the indications for OPA? Number one indication is a patient who is unconscious, semi-conscious without a gag reflex. If the gag reflex is there, then introduction of an OPA can lead to vomiting, right? So the next step is finding out the right size of the OPA. Okay, so always measure from the incisors to the angle of mandible. So look at this. So I am keeping the flange at the incisors and the tip is exactly ending at angle of mandible. So this is the ideal size. So what about the other sides? If you take this one, so this is ending much before the angle. So this is not the ideal size. Always choose the correct size so that it serves the purpose. It removes the obstruction. So next one is introduction of this OPA. How do you introduce? So find out the right size, wear your protective equipments, the gloves, the face mask, and the your face shield. Nowadays it's more required. So introduce the OPA in this fashion. So slide it over the hard palate, and when you feel an obstruction, then rotate the OPA by 180 degrees and place it. So once you have secured, you can either give oxygen by a face mask. In this video I am using an ambu bag. So I am giving oxygen. You can see the expansion of lungs. So this is how you overcome an obstructed airway, especially the tongue in unconscious patients without a gag reflex. So removing the OPA is done in the same curvature. This is the curvature along the hard palate. Just remove the OPA when the patient regains consciousness and he is doing better. So there are some instances where the patient's gag reflex is still intact. So if there is in place an intact gag reflex, if you use an OPA, that causes vomiting or reflux. So in such scenarios, you use another airway adjunct called as NPA. NPA stands for nasopharyngeal airway. So this is again a tube-like structure with a flange. The flange sits on top of the nostrils. So indications: airway obstruction, presence of gag reflex, and always be aware in suspected basal skull fracture, use with caution or do not use at all. And while introduction, be gentle. So next is how to size this NPA, nasopharyngeal airway. So the correct measurement is measure from the tip of the nose to the ear lobule. So this is the right measurement. You take the measurement from the tip of the nose to the ear lobule, right? So how do you introduce? Always inspect the nasal cavity, look for any septal deviation or any turbinate hypertrophy and choose accordingly. Before you introduce, you have to lubricate it. Lubricate well. Once you have done the lubrication, raise the nostrils. The right side is usually preferred, and introduce in a gentle fashion, minimizing the injury to the tissues. And when properly introduced, the flange sits on the nostrils, then you can go for the oxygen delivery, right? Choose an appropriate size mask, use the CE technique, then give oxygen. I am giving through an ambu bag. You can connect the face mask with oxygen to maintain the oxygen supply. So here two things, nasopharyngeal airway and the oropharyngeal airway. Regarding the removal, it is easy to remove. You can remove in the same curvature as you introduced. Okay, thank you for patient listening.